Good day. Cheers and welcome to the webinar on delivering client-focused healthcare, outsourcing your non-core healthcare processes to partners in the Philippines. This event is organized by the Philippine Department of Trade and Industry through its offices in Washington, D.C., New York, San Francisco, and Los Angeles, together with the Philippine Embassy in Washington and the various consulates general of the Philippines here in the United States. I am Nick Bautista, and I will be your moderator for this webinar. This webinar is the 6th installment of the Global Business Processes Powered by the Philippines webinar series. Held every week from August 13 to October 1, top IT BPO executives have been discussing the various outsourced services typically provided by the local IT BPO industry in the Philippines. The webinar series touches on competencies in the following subsectors: virtual assistants, e-learning, creative content and engineering design, call centers, healthcare information management, clinical research, software and app development, as well as finance and accounting. For tonight's webinar, we will be discussing the outsourcing of healthcare information management services and clinical processes by healthcare providers and insurance companies. From Manila, we are joined tonight by Mr. Julian Valenzuela, Vice President and Chief Operating Officer of Visaya KPO, and from Tennessee, Mr. Nathan King, Chief Marketing Officer, Shearwater Health. Our two speakers for today will be touching on the following topics. Number one, an overview of the Philippine Health Information Management Services outsourcing industry, its current offerings, and the typical service delivery models. Number two, the intricacies of the outsourcing arrangement itself, and the critical variables that make for a successful outsourcing arrangement. There will be a short Q&A after the presentations. Our first speaker is Mr. Julian Valenzuela. Vice President and Chief Operating Officer of Visaya's KPO. Julian is a graduate of the Conrad C. Hilton School of Business Administration at the Loyola Marymount University in LA. He has a Bachelor of Business Administration in International Business and Management. He headed the Procurement Council of the Contact Center Association of the Philippines, or CCAP, from 2011 to 2014, playing a key role in assisting CCAP's member companies achieve growth and viability during the period. Julian, you have the floor.
Thank you, Nick. Good morning, good afternoon, and good evening to everyone, depending on where you're at. Let me go ahead and share my screen. Can you see my screen?
Yes.
Great. So again, good morning here from Manila to everybody. And I guess good afternoon and good evening to those in the United States. Welcome to this session. It is entitled Delivering Client-Focused Healthcare, Outsourcing Non-Core Processes to Enable Healthcare Professionals to Focus in Providing Care. And now when we were putting together these slides, I was asking myself, what does non-core processes really mean? And, at first I thought it sounded a little bit unimportant. But, when we put together the slides, the intent here actually, when you really think about it, these processes are actually the real critical processes that enable doctors and nurses to actually focus in providing healthcare. And, that is critical for these doctors groups and these hospitals and these clinics to actually operate. So this presentation is intended to show you exactly what the Philippine healthcare industry is all about and making sure that everyone benefits from better healthcare. So let me begin by providing an overview of the entire IT BPM market. The Philippines is a provider of IT BPM services worldwide, and we offer a wide range of services to the most prominent Fortune 1000 companies in North America, Asia, and Europe. The IT BPM industry is a driver of revenues in the Philippines with $25 billion in revenue last year, as well as 1.4 million employees. And so this includes the global in-house centers. These are the likes of an Optum who've decided to actually set up shop directly here in the Philippines. It also includes the contact centers, the animation shops, software shops, and the gaming industry. And the Philippines has now, proven itself as the #1 destination for offshoring when it comes to voice work. And this voice work does not just include contact center, but it also includes the healthcare piece. And that's something that has really been a driver of growth for the last, I'd say, 7 to 10 years. And so the Philippines healthcare BPO industry is now the second highest revenue generator after traditional contact center work. I also wanted to mention a little bit about the pandemic in this slide and how the industry is coping in these hard times. There was a survey out, I think it was just last month, where the CEOs of all the companies here in the Philippines showed that we've moved 56% of the workforce into a work from home setup from the time that the lockdown began all the way through August of this year. So if you think about that, that's almost 800,000 employees who were moved from an in-office setting to a work from home setting. And so this just shows that, while there are some difficulties, companies like ours, Visaya, are actually fully operational despite all of the lockdowns here in the Philippines. And so this is just a testament to how resilient the Philippines is, and other Philippine companies like ours who have been battle tested and proven BCPs, and we are now ready to take on more work. So the Philippine IT BPM market, it is so big, but the actual fastest growing segment of this market is the healthcare information management section. And it's growing between 7.3 to 10.8%. The Philippines has been known for traditional contact center work for over 20 years now, and it's a proven destination of choice for companies looking to outsource. But I'd say that the last 7 years has seen a move from traditional, repetitive, low-value tasks into higher skilled and higher valued processes, just like healthcare. And even in Visaya, we've seen over half of our businesses grow into the healthcare space very aggressively in the last 5 years. And businesses like Visaya are more experienced in a wide range of healthcare work. So let me actually go ahead and show you an overview of the wide range of processes that can be accomplished here in the Philippines. And the work we do here is extremely important for healthcare providers and payers to succeed in their respective markets. At the top of the slide, you can see that we work with payers and insurance companies to manage their plans as well as their members to ensure that they get reimbursed. This includes provider contract management, membership and benefits, insurance claims, and denials. On the right-hand side of the slide, we work with providers to ensure that administrative work it takes to run their hospitals and clinics are being done so that they have more time to actually practice their healthcare. This includes patient appointments and scheduling, case management, revenue cycle management, and virtual assistance. And on the left side of the slide, we work with pharmaceutical companies. These include drug utilization review, clinical trials management, and pharmacovigilance. And pharmacovigilance right now is very much in demand. You can just imagine, this is the practice of monitoring the effects of medical drugs after they have been licensed for use. And so this would entail folks in the Philippines actually calling upon patients to validate actual medical surveys and to determine if there are side effects to the medication that they are taking. And lastly, we at Visaya believe we don't just outsource people, we provide an end-to-end solution. So whenever we provide a proposal to our clients, we provide this service with technology as a total package. This includes EMRs, data analytics, and data security. So when outsourcing to the Philippines, the place that I recommend most people start is normally the Healthcare Information Management Association of the Philippines. It is a non-profit industry association, and it's meant to promote healthcare information management here in the Philippines. They also sponsor and adhere to quality standards and practices, and they set that bar for all of us here practicing in the Philippines. And the association also helps to build labor talent and upgrade the skills of practitioners in healthcare services. The association is comprised of BPO players and support service organizations, and they also are the venue for industry stakeholders such as the Philippine government. And I will say that during this lockdown period in the last 6 months, HEMAP has been very helpful in making sure to coordinate with all of these companies, making sure that we meet the regulations that are being set out by our government to ensure that our companies operate safely and securely during this time of pandemic. There are over 65 companies now, I think, in HEMAP, and you can see that a lot of these names, some of them are part of the Fortune 1000 who have set up shop here in the Philippines, all the way down to the small companies like ours, Visaya. But I can guarantee that if they are part of this group, the standards that they deploy in terms of services are world-class. Now, when deciding to outsource to the Philippines, typically it is our job to explain why you should do so. And there are 5 main reasons. I guess the first is service diversification. And we can provide all the services in the healthcare space that I've enumerated. And not only that, we are the #1 when it comes to some of those services. Second is the talent pool. Our clients can scale here in the Philippines as we pump out hundreds of thousands of nurses and doctors every year. And I think you would agree with me, even if you take a look at any of the hospitals around the world, you will see the Philippine talent that is available. And those are the kinds of talents that we can deploy when we actually work with our clients worldwide. Third is affinity. And we are truly an Asian country here in the Philippines, but we do embrace Western culture. And so that actually adds an extra layer of why you should choose the Philippines. Fourth is vertical specialization. And we provide a diversification of services that you can see from my previous slide. And lastly, we are a low-cost leader. So when deciding to outsource, there are actually three fundamental structures for outsourcing. First is a captive or a entity or a wholly owned subsidiary. And when this happens, normally a company sets up shop completely in the Philippines. This normally means that you actually have to handle the legal side of setting up a business. It also means that you're hiring the staff, you're actually managing the operations, and you have 100% of the risk as well as 100% of the reward. The second option is actually doing a joint venture with a third-party vendor like Visaya. And this is normally the middle ground, right? So you actually sign an agreement where you can co-locate with the vendor, and the vendor acts basically as an assistance for people to set up their processes here in the Philippines. In this particular case, you actually split the risk, but you also split the reward. And then lastly, it's to contract directly with a third-party vendor like Visaya. And the majority of our clients actually choose this structure simply because it gives flexibility to scale, and they don't have to manage anything internationally. So typically these contracts are about 1 to 3 years, and the pricing ranges, from a monthly per head rate to an hourly rate. Those are the two typical fee structures when outsourcing. The other part of this is after you've actually chosen what kind of structure you want to have when you outsource, you also want to make sure that you can ensure quality, privacy, and security when it comes to your processes. And there are 4 categories that we typically ask our clients to be careful of. First is people. And when we come to recruitment, when we come to hiring, foundations training, we want to make sure that we get the best people for our clients. The second category is processes, and this one is all about control, ensuring that our clients have full control over their processes. And we do this by offering live monitoring, post-transaction monitoring, and performance tracking. Third category is actually technology. And these are the platforms that enable us to actually do these processes on the other side of the world, but make it seem like we are, just down the street. And these are the telephony systems as well as the virtual desktop infrastructure technology. And so when it comes to this virtual desktop, this is really crucial, especially during this time in pandemic, while we have everybody working from home. And the last category is actually compliance. And you will see that these companies have robust systems in place to make sure that we meet the ISO certifications that are required, as well as HIPAA and PCI DSS. HIPAA is actually the standard for healthcare information security, and PCI DSS is actually the standard for credit card information and financial security. And of course, whenever we have voice processes, we also have to comply with TCPA. And I'm coming towards the end of my presentation here, and I wanted to end on a success story or a case study. And while I could have spoken about some of the processes that we do that are, showing numbers in terms of how many thousands of charts we can process in a month, how many charts we can code, or how many, how much revenue we can generate for our clients. Because this is healthcare, I wanted to choose a case study that showed a little bit about the human side. And so this is a case study about the oncology care model. OCM is an episode-based payment system developed by the Centers for Medicare and Medicaid. And essentially, we map out related care during a 6-month period after chemotherapy. And the entire goal of OCM is to actually just reduce costs, but also improve patient outcomes. I wanted to show you an overview of what we've done, as well as the interventions and the outcome. And when it comes to this particular case study, this involves a 55-year-old woman who was diagnosed with stage 4 colon cancer. The difficulties of dealing with cancer is there's really only two outcomes when we talk to our clients. And one is to live and one is unfortunately end of life. But when it comes to what we've done for this patient, there are interventions with care coordinators here in the Philippines. And we were able to determine that the patient was still suffering from physical pain and depression after chemotherapy. And after the consultation, the care coordinator facilitated an appointment with a psychiatrist to treat the depression. And the oncologist was also able to assign a social worker on this case. And as for the outcomes, the patient ultimately benefited from mental health services and end-of-life care through a home palliative care program. And in this case, the provider was able to avoid readmissions, which are very costly. And the patient was also able to benefit from additional healthcare services during that most sacred of times, which is the end of life. So I am happy to say that the patient is still alive today. And we were able to speak to the oncologist, who was able to share with us that without the effective interaction and teamwork between Visaya and the clinical staff, a patient who is in pain could have been overlooked. So when we talk about healthcare, there really is always a human story behind all of it. And that's really what's very much important to what we do every day. And so why Visaya? When you outsource with Visaya, we guarantee that we are fully compliant with international data security and privacy regulations. We also benefit from training programs, and we push our people being the best in terms of skills and in terms of dedication and loyalty to the programs. We are a low-cost leader, and all of our production facilities are fully redundant, and we are open 24/7, and I guarantee we have a long-term partnership with you. In fact, our longest partnership is now 11 years strong. And I hope to say thank you very much for listening to this session. And I'm looking forward to the Q&A session at the end.
Thank you, Julian. Can you hear me now? Sorry.
Yes, Nick.
Okay, certainly an excellent overview of the IT BPO industry in the Philippines and its subsector, the health information management services industry. For the information of our audience, the HIMSS industry in the Philippines is one of the fastest growing sectors in the country right now. And it employs over 1 million people, if I'm not mistaken, Julian, and is one of the least affected sectors in the economy during the pandemic. Anyway, our next speaker is Mr. Nathan King. He's the Chief Marketing Officer of Shearwater Health. Nathan is a graduate of the University of Virginia Darden School of Business in Charlottesville, Virginia. He leads Shearwater Health in providing teams of remote and on-site clinicians that allow its US clients to expand their size and impact and the impact of their clinical teams and to be able to focus more on their core processes. That's all, William, Mr. Nathan.
Thank you very much, Nick. All right, get my slides here in order for you. Well, it's a pleasure to be here. Thank you to the Philippine Department of Trade and Industry for the invitation. It's wonderful to be able to share with you all an important reality about your beautiful country, which is that it's an excellent location from which to practice complex healthcare workflows. And throughout our conversation, I will illustrate that, but I'll also provide information to help you think about offshoring and how you can offshore to begin with. So to begin, I'd like to take a moment and talk about how some of the perceptions of offshoring have been historically. We've all heard of stories about bad experiences for companies who've relied on activity to be done offshore. And oftentimes people will end up describing sending their work offshore as if they're sending it into a black box. And what they mean by that is that a black box has no visibility into it, and you can't know if the work is being done correctly. The result of that is that you're spending dollars and time and significant effort to put processes in an offshore environment, and you don't know what the reality will be coming out. Perhaps it'll be good, but perhaps it'll be like a story that you've read about in a news article or that a colleague has shared that resulted in frustration. So to begin, I'd like to uncover what is going on in the minds of people when they refer to this situation as being a black box to offshore. Well, the first is that there is the fear that there are only low-skilled workers available, and that anything that you're sending over is very limited in terms of what you can do in terms of complexity. It has to be very basic in its quality, and in healthcare, that means the vast majority of what you do is automatically ruled out. If you can't provide complex, patient-oriented workflows in an offshore environment, it means that inevitably you have to do it in the United States, if that were to be true, that only low-skilled workers are available over there. And the next point is that there are communication barriers. We've all heard the stories of language barriers and cultural barriers from one place to the next. In fact, I'd say language barriers are pretty well known in the offshoring industry. They can create, obviously, execution problems and quality problems ranging from customer service issues to people not understanding instructions and consequently not being able to complete tasks on time. And perhaps the most common fear that people have about offshoring is that the infrastructure is inadequate. There may not be appropriate bandwidth for internet. You could even suffer from power outages on some unspecified basis that could interfere with operations. And then what would happen if there's a natural disaster like an earthquake or a hurricane or typhoon? What would happen to the work in such a situation like that? And since we're dealing with healthcare data and considering offshoring healthcare data, can you really trust your data to go offshore in that situation? Can we even believe that the rule of law will protect the information that you're sending offshore? So these are some of the common perceptions that many people have, but I would argue today that that's very incomplete, and I'd like to walk through the reasons why that's the case. And to do so, let's talk about modern offshoring. Our work and our processes shouldn't be relegated to a black box where we can't trust that the work will be done right or on time. But in the world of modern offshoring, you can count on the right talent and support to get you there. In fact, we don't think offshoring is the appropriate word really in modern times. And to unpack what I mean, let's talk about your situation that you're thinking about as you consider offshoring to begin with. So you think about your organization has some limits to growth. The first obvious one is availability of talent. Now in the healthcare world, clinical shortages, especially in nursing, are very well known and talked about, and they limit the ability to bring in enough expertise to be able to execute critical workflows necessary to provide patient care. Well, that's number one, is finding the right talent to be able to grow your business. And the second one is the cost of talent. Clinical talent is in high demand, and it is reflected by rising costs of labor in that area. When you couple that with what is happening in healthcare with margin pressure that has continued to worsen over time as people look to cut costs and preserve as little margin as they possibly can, that talent cost can be excessive. And then the third is the inability to specialize if you are doing many different types of work. And I'll give you an example of that using a hospital. It's very easy to illustrate. You know, the hospital is in the business of providing excellent patient care to provide an outcome to a patient so that they can heal and not return. And that is a core competency of a hospital. It's what it should be good at. I think everyone would agree that's what a hospital should be good at. But the hospital is also in the business of collecting money and billing for procedures as efficiently as possible to collect cash as quickly as possible to sustain operations. That's a drastically different skill set from the skill set required to deliver high quality patient care. And so when you try to manage all of these different skill sets, you can end up in a situation where you're not able to execute well in all of those areas. And that is also going to be a limitation to growth. So what organizations need is the ability to multiply their impact. And that comes in the way of partners who can extend the enterprise. And that's why I think offshoring in modern times is probably the wrong way to think about this. The way a healthcare organization should be approaching the situation is to think about extending their enterprise involving the right partner, which may and probably inevitably will include offshoring. And when you do that, you expand access to resources, you solve the talent problem, you can find more affordable talent, you solve that problem, and then you can specialize. The hospital can focus on its core of providing patient care while simultaneously turning over its revenue collection, to take that example, to someone who specializes in that and can provide the best practices for it. The result is an excellent supply chain can lead to market dominance for organizations that get it right. And we all see hints of that. We all understand in these modern times that you have to cooperate with other organizations in order to compete in the marketplace. I'll give you another example just to illustrate the point of how an extended enterprise can deliver better patient outcomes. In hospitals in the United States, value-based care is a very important term and emerging trend. And a key element of value-based care is to reduce readmissions. In other words, a patient leaves the hospital. The goal is to keep the patient from having to come back to the hospital. It is a problem with the quality of care when people are discharged and then either the right care wasn't delivered or they aren't able to appropriately take care of themselves after discharge and they have to come back. And that leads to higher mortality and higher cost, among other problems. So a discharge program would be a situation where a patient is discharged from the hospital and then a clinician follows up with the patient at home to make sure that medication is being taken, that any questions are being answered, that any directions from the provider are being followed appropriately. And the value of that is pretty immense. It has been demonstrated to reduce readmissions to the hospital. But it's very difficult for hospitals to execute on that because their core focus is the patient that's in the hospital. And so by having a partner that can provide the discharge program to follow up with patients outside of the hospital, then that can help the hospital have better outcomes for its patients while at the same time not having to dedicate talent to yet another type of healthcare task, which is monitoring patients who have been discharged who are now outside of the hospital. So it makes sense. It's very logical that offshoring is a valuable strategy to help healthcare organizations grow and satisfy their customers and their patients. But as you consider going down that path, you must also consider that there could be danger around the corner. You could get somehow captured by some event where you're unable, the mud is too deep, you're unable to proceed, or perhaps there's a tiger lurking around that corner. So understanding those dangers can give healthcare organizations pause because they don't know the unknown. But the key questions that healthcare organizations really need to keep in mind are, is it possible to collaborate outside of the walls of the enterprise? And if it is, how do I do it? How can I trust someone to do it? How do I know that I can trust them? And then will it produce the results and the return on our investment? It gets to that black box problem. And then when something happens in the world, like a pandemic or an earthquake or volcano, how will I know that I will be treated as a top priority if by whoever I'm offshoring my work to? So these are the key questions that you need to answer. And for that, I think that's where the benefit of a partner comes in. Take us, for example. I work for Shearwater Health. We are wholly dedicated to deploying clinical talent on a global scale to be able to solve healthcare problems. In fact, we're so committed that we named our company after the bird called Shearwater, which you see in the picture. A shearwater, it has the longest migratory pattern in the world. It travels around 30,000 miles every year, going from one place to another. It bridges the globe, and we take a lot of pride in that name. And we have been offshoring to the Philippines since, well, we've been working with Philippines talent since 2001, and we have had centers in the Philippines since for about 10 years, and I'll touch on that in a moment. But first, a bigger question is why the Philippines? You know, we're an American company. American companies typically look at offshoring not as in partnering with a specific country, but as in adopting a geographic strategy of diversification where you might put some work in country A and some other work in country B. That way you spread the risk and you prevent any overarching quality problems, or if there is a significant problem in one location due to a climate event like a typhoon, then you won't be disrupted severely. But we focus on the Philippines, and the reason that we focus on the Philippines is very simple. The talent is outstanding. The English speaking ability is excellent. The nursing education matches the quality of the education in the United States. And there's an outstanding nursing reputation. I mentioned that we started working with Filipino talent in 2001, and we bring, still today, and we started then, we bring nurses from the Philippines to staff hospitals in the United States, where they're working with the sickest patients in the world, and providing the highest quality of care that you can provide. In fact, those are pictures of some of our nurses in US hospitals there on the screen. And then the last reason is political stability. The Philippines has had for many decades a stable political environment. There's never a question of whether there will be a problem that would make it difficult to execute. So that has given us comfort to grow our business. And our business really resembles what we think of as an import-export model, which is where we're bringing Filipino nurses to work at hospitals in the United States, and we're sending healthcare work to the Philippines. Now, the type of work that we're doing inside of the Philippines ranges in complexity, but I'll give you an example. Just we picked some characteristic workflows that we're doing. It can be as basic as intaking claims, where we're taking healthcare data, we're having a nurse in the Philippines review it and make sure that it is systematically categorized in the appropriate way. That ranges all the way up to telephonic types of work, where we are doing care coordination type of work or other types of healthcare interactions. And then that could also include doing medical coding, which is fairly complex. And in the United States, nursing talent is so scarce and so expensive that it is not a requirement in the United States to perform medical coding. But in the Philippines, we've adopted a strategy of using registered nurses to perform that work. That results in higher quality because they better understand medical information and how coding should be done appropriately for that. So as you are looking at that, that's why the Philippines, and we've covered the importance of having the right partner to work with. And the next is you've got to have a framework. You have to have the right framework in place to make sure that you can deliver the outcomes that your patients or your customers require. And if you think of you in the middle, extending your enterprise outwards is really going to involve a focus on a framework that includes talent. You have to be able to find the right talent. So not just any nurse, but a nurse with the right English speaking ability or the right clinical experience, the right background. And then you must be able to retain that talent over time so that people become familiar with your custom workflows and are able to deliver that day in and day out without the risk of feeling like you're going to have to train someone new. So talent retention is a very important part that you should remember. And then training is the next thing. A training system across in a trans-Pacific environment needs to be very carefully managed and very carefully coordinated between the client and the supplier of the services to make sure that your workflows are being delivered in the right way. and a training team with the right technology make a big difference in doing that. And then the last is performance management. There are always things changing. There's a ton of variability in healthcare. The ability to monitor output, measure efficiency, and keep things on track is just critical for people to be able to do. But you don't only need the right framework. The next ingredient that's necessary in order to make offshoring work well is to have the right physical infrastructure and security. On the left hand of this picture, you can see our actual office in Manila. It's as modern a building as you would find in New York or San Francisco. And there is also a very strong security presence for that building to make sure that data is maintained in the appropriate way. And you can see that on the right-hand side, you get a glimpse of how we are able to monitor with the latest technology, everything that's happening in our center. Additionally, on security, we have instituted biometric devices, which you can see on the right-hand side. And then everyone is tracked entering and exiting the building to make sure that only the right staff are brought in. And then the last part of security, which is at least as important as these other attributes, is what you do with the data. Julian talked about HIPAA a few moments ago and how important it is to be able to adhere to HIPAA standards in the United States. There are very comprehensive regulations that healthcare organizations in the United States has to follow. So it's a valid question for an organization in the United States considering working in the Philippines to make sure that HIPAA guidelines can be followed and enforced by the partner. A big part of that is where the data is going to reside. And for us, we've adopted a strategy that all healthcare data that we work with is going to reside in the United States. From the Philippines, it is accessed through US-based infrastructure. And depending on the client situation, we're either utilizing our own data centers, which are located in the cloud, but ultimately based inside of the United States, or we are using a VPN environment to tunnel directly into our client's infrastructure at their facility inside of the United States, wherever that might be. So a US-focused data storage approach has been a very valid approach for us to use to make sure that data is maintained in the right way. But we go beyond that. There's an organization in the United States that provides certification around security. There are a number of them. We've adopted high trust certification in the Philippines. That means that we are accredited in the Philippines to the same standard as a high trust organization in the United States. We also have SOC 1 and SOC 2 compliance on all of our data, which is a very important level of certification that healthcare organizations in the United States would be expected to have. And then finally, we are accredited by URAC, which is another US accrediting body. And we have ensured that our Philippines operation in the Philippines, in Manila and in Cebu, have also been accredited by that organization. Now, I'll close with an example of, well, how do we know that this can work well? There's no other better example, and I suppose I should say unfortunately, because we're all contending with it now in the COVID-19 pandemic. But it does provide a very good example of how you can continue to perform at a very high level in such unusual times as these that are impossible to plan for. And so here is just a quick look at what the Shearwater response was to the COVID-19 situation. In the middle of March, it was made clear that you could not you could not continue working as usual in the Philippines. A general quarantine was announced, but Shearwater was able to, within 72 hours, transition 1,800 employees to a work from home environment. We could not have done that without the flexibility of our vendor partners who are in the Philippines. So I think that's a good indication of the level of sophistication and maturity of the economy of the Philippines. And we certainly couldn't have done it without the partnership of the Philippine government, which helped us navigate the regulations in order to make sure that we could do that effectively. And then I guess the next valid question is, well, okay, you transition to work from home. How does that work? Well, in that environment, we were able to maintain the same level of IT security by taking the right infrastructure to the homes of our employees. And the majority of our employees had the right infrastructure at home, the right bandwidth to be able to work on their US clients. And 90% of them were able to do that. And then we were able to achieve 100% service level achievement for all of our clients in the US. It took a lot of work. We felt like we became a logistics company to some degree. We procured 25 vans to help us transport 3,000 workstations to our employees. We put up 200 employees in hotels to be able to work from there when they didn't have infrastructure. And then at the office, we maintain a skeletal staff to make sure that sensitive work that can't be done in the home is still able to be continued. To wrap all of this up, offshoring is a central strategic element of growing a modern healthcare organization. You can create an extended enterprise with a partner who can enable scale and performance in an offshore environment that is secure in the Philippines, which is a country that has the proper national foundation to support growth. Thank you very much for listening, and would love to answer any questions that anybody has.
Thank you, Julian. 72 hours transitioning to work from home. Fantastic. Almost 100% achievement of service agreements and a 90% productivity. That's fantastic. I think the first question is for Julian. Julian, what safeguards have you implemented in your company for your employees that are working out from their residences to ensure data security and privacy are maintained?
Sure. Yeah, I much like Nathan, I do recall when it was in March that the president, decided we're going to lock down the Philippines. And I think it was around 8 p.m. in the evening that he made the announcement. And we had until about 12 midnight to decide what we're going to do. We only had about 4 hours. And so, I think the first step that we took was to really have frank conversations with our clients and really decide, together as partners, which, strategy we are going to take. Some of them were very amenable to the work from home scenario and were, wanted to work with us. And, in those cases, we've been able to, justify, I guess, 4 safeguards. I guess first being that all of the PCs that are being used are company PCs. And that means that it has all the safeguards, all the technology right there. And, we have not allowed using personal PCs for anybody who's doing work from home. Second is actually utilizing a virtual private network. And, I mentioned earlier the platforms required to do the work that we do. And much like what Nathan was mentioning, none of that data resides locally here in the Philippines. And certainly we want to make sure that none of that data resides locally with the employees, especially while they're at home. So we've utilized that VPN network. We've utilized that technology as a platform to ensure that all the data still remains with the clients. Third is really, and this sounds kind of funny, but to make sure that there is a safe zone. So much like what we have in our offices, which is like what Nathan mentioned, making sure there's this physical safety present in terms of the physical safeguards. We've also made sure that, employees have to prove that they have a safe zone within their homes, which means that it's a private room. Nobody can utilize that room while they're working. And that indeed they're not sharing. It could be a family, with 6 kids and they're all in one room working together. We've actually asked them to employ the same physical standards that we have in the office at their homes. And then lastly is actually updating all of our employment contracts to make sure that all the HIPAA safeguards that are required of us as a vendor are also deployed with the employees at home. And I will also say that not all clients have been open to the work from home model. We've had clients who've actually insisted upon making sure that their processes remain within the HIPAA certified facilities that we have. And us in Visaya, we actually have 2 sites. One is in Metro Manila, and the second one is in Dumaguete, which is about an hour south of Manila, which allowed us to actually have that BCP ready to go and deployed, right away. And so when it comes to, addressing those concerns, we were actually able to re-up and retrain a lot of our staff in Dumaguete to offset those who could not do the work from home here in Manila. And I think that that's really a key strategy that I would recommend to most of our clients, is to actually spread the risk by diversifying the locations. And vendors like us, vendors like Nathan, where we have multiple sites, does just that.
Ooh, thank you. That's a lot of work. That's a lot of work. Your offices are in Manila, you say, in Dumaguete,
That's
and
correct.
Shearwater is in BGC and Cebu.
That's
Am I
exactly
right,
right.
Nathan?
Yes, yes.
The, by the way, that last question was from Mylene Reyes, and she has another question this time for Nathan. And she asks, Nathan, how diverse is your pool of clinical talents? Do you have respiratory therapists who are licensed in the US and Manila?
Yeah, that's a great question. The majority of our associates are nurses. However, certain workflows require different talents, and those numbers will ebb and flow just depending on the types of work that we're doing for clients. We've employed physicians, we've employed physical therapists pretty routinely. Respiratory therapists, off the top of my head, I can't recollect whether we've employed respiratory therapists for particular workflows, but we've also employed lab techs and other occupations in the healthcare area.
Okay. Maybe both of you or one of you can answer this one. What are the processes that the Philippines can offer in support of clinical trials? As you may know, there's a lot of federal funding for clinical trials going on right here in the States. A lot of universities are getting grants from the NIH to support studies of certain therapeutics and some for vaccines. Yes?
Yeah, so for clinical trials, I mean, it is something that is booming right now. Obviously, we cannot do the physical clinical trials here in the Philippines because that's being done with patients abroad. But we can help with the administrative side. So, like I mentioned earlier, pharmacovigilance. This is actually measuring, the side effects or potential side effects of medicines after they've been licensed by the Food and Drug Administration. So when that happens, we actually have our associates here in the Philippines call upon these patients in the United States to actually do the medical survey. So that's just one example of what we can do with clinical trials. There's also an analysis that needs to be done. So there's a lot of data that is captured when it comes to clinical trials. And we have some of the resources here in the Philippines that can actually do that data analytics. And so it's not always, when we talk about healthcare, it's not always hiring the right nurses and the right doctors, which we do have on staff, but it's also hiring data scientists and data engineers to make sure that we can do the processes that it takes to do work like clinical trials, the data analysis, as well as the reporting that comes with it.
Okay, yeah, and I would only add, I just think the Philippines is really well positioned to support clinical trials. And for all the reasons Julian mentioned, there's obviously a component that has to be done physically in proximity that you can't offshore, but it is a very routine area that can receive expertise from the Philippines.
Yes. Nathan, we have a question from Special Trade Representative Raymond Batak. And he asks, do differences in standards and regulations between the Philippines and the US come into play when outsourcing healthcare work, even if it's non-core?
We follow US standards since all of our clients are American. So we follow US standards for all of the work, and so those regulations are the focus. I'd say the only thing that's distinctive is that in the Philippines, there's the Data Privacy Act, or the DPA, which has its own safeguards for to protect Filipino nationals. And because we employ Filipino nationals, we make sure that we adhere to those regulations as well. But it's a very comprehensive and carefully constructed framework of regulations that put Filipino privacy interests at the heart of it. And so we support that as well. We think it's just good business, even if it weren't a regulation. So it's So other than that, we really don't see much of a interplay with the regulatory side.
Okay. Do you
Yeah,
have
in
anything
fact,
to
I would
add?
just add that, here in the Philippines, much like what Nathan mentioned, a lot of what we do here actually adopts the standards that were set in the United States in the first place. And that probably has a lot to do with the cultural affinity that I also mentioned in my presentation. And so that goes all the way through to the regulations that we have to employ, obviously, in the work that we do, including the HIPAA and PCI DSS. So the reality is there is a standard when it comes to data security. There is a standard when it comes to good business that I think is universal.
Yeah. I have a question for Julian, and maybe this is me failing to understand the case study that you presented. In both the case of the 55-year-old female diagnosed with neuroendocrine carcinoma and the 81-year-old patient with stage 2 breast cancer, who was your client? Was it the SCSW, the patient's family, Hackensack Meridian, or a clinic that attended to the patient? I wasn't
Yeah.
so clear.
Yeah.
Sorry.
So thank you for that question. We actually work with the largest oncologist group in the Northeast, and there are hundreds of oncologists, and so we were contracted by them to actually deploy in their OCM model care coordinators here in the United States. And I'm sorry that was not clear in my presentation. So
No problem.
what we've got is actually registered nurses here in the Philippines who call upon all the patients who are enrolled to this program. And we make sure that, amongst other things, are you actually taking the medicine you're supposed to take post chemotherapy? But at the same time, also validate, if there are any other developments with these patients. And again, like I mentioned before, the goal is to actually reduce readmissions, which is the #1 goal, simply because that's so expensive. And so, that's the way that we help reduce costs. And the way that we also help improve patient outcomes is to make sure that we can recommend additional services, not just, going back to the oncologist and saying something's wrong with me, but be more proactive to assign, social workers or assign palliative care post chemotherapy.
That's great. Thank you. I believe this is for Nathan. Guam was a nursing shortage even before the pandemic. The pool of local nurses is not enough. Recruiting foreign nurses is challenging because of the visa issue. Foreign nurses can be recruited via the H-1 visa now. How are you able to bring nurses to the USA?
It's a great question. It's been challenging, and we've continued to be able to bring nurses throughout the pandemic, but at a reduced rate. So not as many because of the logistical challenges. However, the demand, as that questioner mentioned, is still very high. For that reason, we're still actively bringing nurses in, and I'm familiar with the situation in Guam. We actually don't use the H-1B visa. We use the EB-3, which is a permanent immigrant visa. It's just a much more straightforward process. There are some complications with the H-1B that have never really been favorable. But that's in a nutshell, that's what we're doing and how we do it.
Okay. This is for both of you from Mylene Reyes. Do you guys implement a clean desk policy? If so, how do you implement this policy when employees are working at home? And are they allowed to use their cell phones while working? And how do you monitor if they are using their cell phones at home?
Yeah, so in a typical environment, a typical day pre-pandemic, obviously the answers to all of that is absolutely yes. We employ a clean desk policy. Much like what Nathan showed, we do also have biometric access, and our production work area is a clean room. And so those are still in effect today. And on top of that, we've actually added that you have to have masks and social distancing and the like. But when it comes to the home, we have to be a little bit more practical about that. And that's why I mentioned earlier, a strategy we've deployed is a safe room, still in their homes. And so we call it safe zone because some of our employees could not employ, dedicate an entire room, but they could dedicate a portion of their room where they, basically created their own work environment. And that includes, promising, and that's why I was mentioning earlier that we've redeveloped our employment contracts to ensure that all of the safeguards of HIPAA are actually being deployed even at home. What we've done, other than the honesty, the honesty policy, is to also do audits. And so this includes our auditing staff to individually check, can you show us a picture? Can you show us where you're actually working? Can you show us what practices you're utilizing to ensure that you have that safe zone at home? It is, it has been difficult and there are still risks with it. And that's why it's very crucial that you actually have to work with our clients to ensure that that partnership exists, and they have to be willing to trust. I think Nathan mentioned that earlier in his presentation. Trust is really crucial. And we've had clients that are open to it, like I mentioned, and others who have not. I will say this though, we've had 6 months of data now when it comes to work from home versus working on site. And, at least on paper, when we run the reporting in terms of metrics, when we run the reporting in terms of outcomes, there really is no difference between those working at home and those actually, working on site. If anything, I would say the ones working at home have a tendency to have higher productivity simply because, the infamous traffic that we have here in Metro Manila and Cebu, you could have an hour and a half, 2 hours of traffic both ways. That has been cut out. And, what we've been the beneficiaries of more productivity because they have more time.
I hope your employees, Julian, are not listening to you now, because that sounds to me like a work from home till 10 years from now. But anyway, maybe to you both, has there been a significant increase in demand for any particular kind of work as a result of the COVID pandemic?
Julian, you want to take that first?
Sure. For us, I mean, that's good. Good question. We've seen an increase in interest in COVID monitoring related work and in care coordination related work to support telehealth workflows. I'd say that's the largest uptick. Apart from that, we have continued to see pretty strong interest from organizations that see that there's a lot of value in offshoring their clinical workflows, even in these times, which has continued as usual.
Right. I would add that, doctors groups who've really been impacted, and I think it depends highly upon where their hospitals or clinics are physically in the United States and how long the lockdowns have been. I will say that, those who've been experienced a much stricter lockdown, we have seen that business highly impacted, right? So that has dropped. But then on the other side, we've seen that a lot of the telehealth and telemedicine has grown in terms of demand, and we have been deploying more folks for that. So our voice services have grown. I would also say on the payer side, when it comes to insurance companies, that demand has not stopped. There has been no change whatsoever in that demand. And in fact, we're at that point where we're actually doing a lot of the chart collections right now, medical records retrieval. And that's the first step in the revenue cycle before coding. And we're seeing that demand this year has actually picked up.
Yes. The next question is related to not potential, but to resulting opportunities as a result of what's happening. We have a question from our special trade representative in Washington, D.C., Raymond Bata. He's in Washington, D.C. precisely to monitor this kind of federal policies that will tend to affect and influence our industry in Manila. And he asks, the U.S. government plans to roll out an IT infrastructure mechanism to support the U.S. administration's monitoring of COVID-19 vaccines next year. Can companies such as yours perform any of these functions? And if so, what could this be?
Well, if the ultimate infrastructure is done correctly, at least the way we think is correctly, then yes, there is a way to support it. Because if you think about it, it's probably a remote monitoring function, which would involve having a clinician be available to support cases that emerge that require clinical attention. And the Philippines is ideally situated to be able to respond in such a way. I think there are still questions about what the final IT infrastructure will look like around that, and so we're watching it closely to see how it evolves. But we do see potential there. It's a great use of clinical resources in the Philippines to participate in that.
And I agree with Julian. The data analytics will play heavily in this kind of work, because when you ask respondents and you monitor their reaction to the vaccine, to their temperature, and then you crunch these numbers and you try and come up with some sort of a conclusion. You would need lots of people to handle 30,000 respondents and so on.
Yeah.
Do you wish to add anything, Julian?
Well, the only thing I'd add, I mean, I agree to everything that you said, Nick, as well as Nathan. The only other thing there would be, we've experienced working with the federal government, and there are lots of processes and extra burdens when it comes to actually getting and securing those contracts. We've done it in the past. I'm not saying that I wouldn't want to do it again in the future. But I never want to say no to the work, but it is one of those considerations that we'd have to make if it's a federal program. Now, if it is a private program, that's a very different story.
Okay. Feels like we've had a very productive webinar tonight, this afternoon. I'd like to thank you both. Are we showing our next set of these are the information for our audience, contact details of the two companies that presented, Visaya KPO and Shearwater Health. You can also get in touch with any of us DTI representatives here in the United States. We are based in New York, Washington, DC, San Francisco, and Los Angeles. We can relay your questions. Some we can answer. We can direct you to appropriate parties in the Philippines. We have 2 more webinars coming up. I think the information will be flashed. There you go. We hope our audience will be able to join us again. We promise to bring you again very current, very relevant information about this sector in the Philippines. We will also be having this Outsourcing Summit 2020 on the 8th of October. This is going to be, this is being organized by Outsource Accelerator, a nonprofit outsourcing group with offices around the world. And this will feature a lot of speakers, high-profile speakers from the local IT BPO industry, not local, but global IT BPO industry, and government officials in Manila. Please register so you can get the Zoom details. Are we done? Again, thank you for joining us, our audience in different parts of the United States, so our presenters. I enjoyed your answers, and the presentation was very, very informative and pretty much comprehensive. Learned a lot today. So, are we done? Are we taking a picture? Yeah, a group picture.
The most Filipino of things, definitely.
The most Filipino thing. Raymond is not here. Raymond, where are you, Raymond? Anyway. Who's taking the picture?
Celine is taking, right?
Yeah, sorry. I was
okay.
Another one.
Okay. Thank you, everyone. Andrea, Celine, Eric,
thank you very much,
Raymond.
Nick. Appreciate it. Thank you to the entire team for putting this together.
Yeah.
Very nicely done. Thank you for letting us be here.
Thank you. Thank you for being our presenters. Thank you. Good night.
Good night.
All our participants. See you again next week.
All right. Bye.